Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 8th topic. Determining centric relation. 8. Determining centric relation. Contents. What is bilateral manipulation? Step 1. Step 2. Step 3. Step 4. Step 5. Step 6. Load testing. Significance of load testing. What is bilateral manipulation? The concept of centric relation is backed by over 80 years of theoretical development by dentists and researchers worldwide. Mastering the theory of centric relation is no easy task for the average dentist. However, for us general practitioners, what matters more than mastering the theory is accurately obtaining the patient's centric relation, demonstrating the cause of malocclusion to the patient, and helping patients suffering from temporomandibular joint disorders. This time, we will provide a detailed explanation of the method for obtaining centric relation bilateral manipulation as described in Dawson's functional occlusion. Bilateral manipulation. Step 1. First, recline the unit's backrest to place the patient in a horizontal position. The surgeon guides the patient's chin upward. Bilateral manipulation. Step 2. Secure the head to prevent movement. A common method involves adjusting the unit to the appropriate height and supporting the patient's head with the operator's forearm against their chest or abdomen. In practice, this method need not be rigidly followed, as it depends on the operator's physique. The crucial point is to firmly secure the patient's head to prevent movement when guiding the mandible. Failure to achieve centric relation often occurs precisely because the head shifts during mandibular guidance. Bilateral manipulation. Step 3. Lift the patient's lower jaw and stretch the skin on the front of the neck. Stretching the skin on the front of the neck naturally pulls the lower jaw backward. Bilateral manipulation. Step 4. As shown in the figure on the right, place the pads of 4 fingers from both hands along the lower edge of the mandible. Position the little fingers slightly behind the mandibular angle. Imagine lifting the patient's mandible as you place the pads of your fingers along the lower edge of the mandible. It is important to keep the 4 fingers firmly pressed together without spreading them apart. Bilateral manipulation. Step 5. As shown in the upper right diagram, bring the tips of both thumbs together, with each hand forming a C shape. Place the thumbs in the hollow of the chin. It is important not to apply strong pressure with the fingers. All movements should be performed gently. Verify that all fingers are positioned correctly. Specifically, as shown in the figure below on the right, the 4 fingers must be placed posterior to the central part of the mandible. The reason is that all the muscles responsible for closing the mouth are located posterior to the central part of the mandible. Bilateral manipulation. Step 6. The practitioner gently and slowly guides the mandible through hinge movement using their fingers. If this hinge movement can be performed smoothly, the mandible will naturally glide into centric relation. If the practitioner attempts to forcibly guide the mandible into centric relation by applying strong pressure, the masticatory muscles will reflexively contract, making centric relation guidance more difficult. The purpose of this step is to deactivate all masticatory muscles, allowing the mandible to perform hinge movement solely through the gentle motion of the practitioner's fingers. Caution is required, as excessive hinge movement at this stage can cause masticatory muscle tension, leading to failure in guiding the mandible to the centric position. Load testing. The overload test is an examination where pressure is artificially applied from the mandibular condyle to the mandibular fossa while the mandible is guided into centric relation. As shown in the figure on the right, pressure is applied upward with 4 fingers placed on the posterior part of the mandible, while the thumb applies downward pressure on the mental region, thereby applying upward pressure from the mandibular condyle to the mandibular fossa. It is crucial that the upper and lower teeth do not make contact during this process. When performing this overload test, pressure should be applied gently at first and then gradually increased. The reason for this is that if excessive pressure is suddenly applied when the articular disc is displaced, it can damage the posterior disc tissue, potentially causing significant pain. Therefore, when performing the overload test, the patient must always be asked, "Do you feel any pain or discomfort in your jaw joint?" Significance of load testing. The overload test is a manual jaw joint loading test performed by the practitioner's fingers, eliminating the influence of occlusion. If pain occurs during the overload test, it is judged that an organic disorder has developed in the jaw joint. If no pain or discomfort is felt in the temporomandibular joint during the overload test, that mandibular position is considered the centric relation. In other words, when the tissues within the temporomandibular joint capsule are healthy and the mandibular condyle is positioned in centric relation, applying firm pressure during the overload test should not cause pain or discomfort in the temporomandibular joint. Standard occlusion theory for TMD. 8. Determining centric relation is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 9. Malocclusion.